Hi guys, so this is going to be a series of videos to address some of the issues that we talked about when we did the squat video, which I think we posted, was it last week?
About a week ago.
About a week ago. So if you're having difficulty with your squat, you're feeling it in your back, which may just be because biomechanically you're not suited to squatting, but if you're an athlete that needs to squat, you're a powerlifter, strongman, and you're still feeling it in your back, we suggested that your back might be a consequence of some issues that are going on either upstream or downstream. So in these next few videos we're going to address hip, knee and ankle mechanics. So hip wise, a lot of you are getting down into the bottom of the hole and you're finding that you're running into what I would probably describe as a soft tissue block. So your hip flexors are really tight, and that's a consequence of kind of sedentary lifestyles. We spend a lot of time sitting down these days. Hip flexors get very tight. Your hip flexors actually attach onto your lumbar spine. So they go from the back and dive through to the front and onto the lesser trochanter, which is just on the inside of your thigh. So they're a big muscle group. They're able to directly influence the amount of curve in your back if they're too tight, and that might put more or less compression through the structures at your back. So if it's tightness you're feeling, we're going to adopt what we call a couch stretch. Now with this one, the closer your knee is to the wall behind you, or the chest of drawers behind you, the more intense the stretch becomes. So start easy, and as you get more flexible, progress slowly into a more aggressive position. Common mistake people make here is they try and arch the back, which actually takes the pressure off your hip flexors. So keeping your back flat, we're going to try and push forward from the hips, which you'll feel will open up the hip joints and start to stretch out those muscles. Camping out here for about 2 minutes on each leg, because the longer you spend in a position, the more elongation takes place in the muscles. And in order to make those long-term changes, you need to do this for around about 21 days. So that's piece number one for your hip. Piece number two, a technical fault there. Piece number two, this is still for your hip, and this is more about trying to get into position. So for those of you struggling to hit depth, to take your hip joint below parallel, this might be a way to address that. So power band, pick a nice thick big green power band onto your power rack. Step away from the power rack, so you've got loads of tension then through the band and your hips being pulled laterally, pulled out. Now if you think about the bottom of your squat position, essentially that's what we're trying to replicate here. And then what we're going to do is oscillate in and out of that position. So essentially we're trying to take our hip joint below the knee joint. So we're going to oscillate forwards and backwards. The more tension here, the more you're going to clear out the hip joint, the more you're going to open up the hip joints and allow yourself to clean out those corners. And again, I'd spend 2 minutes in this position, swap legs, 2 minutes on the other side. So those are your two pieces for your hip.